Telmisartan is an ARB used to treat hypertension, diabetic nephropathy, and congestive heart failure. In this video, let's found. What is telmisartan? What is telmisartan used for? Contraindication. What are the side effects of taking telmisartan? How does telmisartan work? How to use telmisartan? What is telmisartan? Telmisartan, sold under the brand name Micardis among others, is a medication used to treat high blood pressure, heart failure, and diabetic kidney disease. It is a reasonable initial treatment for high blood pressure. Versions are available as the combination telmisartan/hydrochlorothiazide, telmisartan/cilnidipine, and telmisartan/amlodipine. Telmisartan was patented in 1991 and came into medical use in 1999. It is available as a generic medication. In 2020, it was the 248th most commonly prescribed medication in the United States, with more than 1 million prescriptions. What is telmisartan used for? Used alone or in combination with other classes of antihypertensives for the treatment of hypertension. Also used in the treatment of diabetic nephropathy in hypertensive patients with type 2 diabetes mellitus, as well as the treatment of congestive heart failure, only in patients who cannot tolerate ACE inhibitors. Contraindication. Telmisartan is contraindicated during pregnancy. Like other drugs affecting the renin-angiotensin system, RAS, telmisartan can cause birth defects, stillbirths, and neonatal deaths. It is not known whether the drug passes into the breast milk. Also, it is contraindicated in bilateral renal artery stenosis, in which it can cause kidney failure. Side effects. Telmisartan use can result in changes in vision, dizziness, lightheadedness, or fainting, fast heartbeat, large hives, painful urination or changes in urinary frequency, swelling in the hands, lower legs, and feet. Pharmacodynamic. Telmisartan is an orally active non-peptide angiotensin II antagonist that acts on the AT1 receptor subtype. It has the highest affinity for the AT1 receptor among commercially available ARBs and has minimal affinity for the AT2 receptor. New studies suggest that telmisartan may also have PAR agonistic properties that could potentially confer beneficial metabolic effects, as PAR is a nuclear receptor that regulates specific gene transcription, and whose target genes are involved in the regulation of glucose and lipid metabolism, as well as anti-inflammatory responses. This observation is currently being explored in clinical trials. Angiotensin II is formed from angiotensin I in a reaction catalyzed by angiotensin-converting enzymes, ACE, kinase 2. Angiotensin II is the principal pressure agent of the renin-angiotensin system, with effects that include vasoconstriction, stimulation of synthesis and release of aldosterone, cardiac stimulation, and renal reabsorption of sodium. Telmisartan works by blocking the vasoconstrictor and aldosterone secretory effects of angiotensin II. Mechanism of action. Telmisartan interferes with the binding of angiotensin II to the angiotensin II AT1 receptor by binding reversibly and selectively to the receptors in vascular smooth muscle and the adrenal gland. As angiotensin II is a vasoconstrictor, which also stimulates the synthesis and release of aldosterone, blockage of its effects results in decreases in systemic vascular resistance. Telmisartan does not inhibit the angiotensin-converting enzyme, other hormone receptors, or ion channels. Studies also suggest that telmisartan is a partial agonist of PAR, which is an established target for antidiabetic drugs. This suggests that telmisartan can improve carbohydrate and lipid metabolism, as well as control insulin resistance without causing the side effects that are associated with full PAR activators. Half-life. Telmisartan displays bi-exponential decay kinetics with a terminal elimination half-life of approximately 24 hours. Dose. The dose of this medicine will be different for different patients. Hypertension. Indicated for treatment of hypertension. Dosage must be individualized. 40 mg per day PO initially, titrated to 20 to 80 mg/day PO, depending on response. Patients with volume depletion should receive the lower dosage initially, under close supervision. Most of the antihypertensive effect is apparent within 2 weeks, and maximal reduction is generally attained after 4 weeks. When additional blood pressure reduction is required after the 80 mg dose, a diuretic may be added. Cardiovascular risk reduction. Indicated for cardiovascular (CV) risk reduction in patients unable to take ACE inhibitors. 80 mg PO QD. Unknown whether doses lower than 80 mg are effective in reducing the risk of cardiovascular morbidity and mortality. Safety advice. Pregnancy Category D. Use of drugs that act on the renin-angiotensin system during the second and third trimesters of pregnancy reduces fetal renal function and increases fetal and neonatal morbidity and death. That's all the information about Telmisartan we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.